Top of the morning, Mike Galbraith here, family and sports medicine physician, joined by a couple of my favorite people today.
Brian Boehme, physiotherapist at Elite Sports Medicine.
Extraordinaire.
And?
We've got Bernie with us today. Bernie is part of our fan club, and he wants to join us to help demonstrate some shoulder exercises and stretches.
We're excited to have him. This is great.
So we have another video that goes over just really simple shoulder stretches. So this one is going to be like 2.0, advanced.
Yeah, maybe a little bit more advanced. Not much, but still.
You betcha. So the first one I like to do is using some kind of weight. Some people call them Indian club exercises. We won't go over a ton of Indian club exercises, but do you want to show them what an Indian club is? It's like a weighted bowling pin, kind of.
Yep. It's, how much? How? So
they often come in 1 pound, 2 pounds, or if you want to get really fancy, they get more fancy. This one's just heavy, kind of plastic.
Yeah.
So this is a 2 pound weight. So the first thing we're going to just show, if you don't have that, this is just a 2 pound weight, and I'll show you kind of a variation of that. So first, we're going to just focus on going forward. So maybe...
Okay. Just like that.
Perfect, yeah.
Okay.
That's beautiful.
How fast?
So nice, slow, controlled motion. It's great. And then little by little, as you get kind of more and more confident, then you can really start getting way up. And then I'll almost start... I'm going to try not to hit you.
That was awesome.
Or the table. And then you can just start getting even more at the top range up high.
Oh, yeah. I can feel that momentum just helping me get back there.
But having just a little bit of weight at the end will help you get a little bit more of a stretch. And now let's have you try doing the abduction one. So
okay,
maybe
so just kind of angle like this?
I just want you to hit me. Yeah,
oh,
okay, I'm going to stand
that.
to the side, and then maybe I'm going to have you kind of reach across, and then
okay.
up. Whoop, yep, that's what I'm going to make sure I'm behind.
That was close.
This so far.
That feels good.
You look good.
Thank you.
Now I'm going to see Brian as he reaches across more, then can he eventually get a little bit higher up to the side?
Oh, yeah.
I'm almost afraid you're going to come around and whack me with that thing.
I'm thinking about it.
Yeah. All right, maybe we should stop Indian club exercise before something really dangerous happens. So
those are easy, though.
Those are beautiful.
Use that weight to as momentum, is that right? That's the idea?
That's exactly right.
I like it.
And then how about...
Let me pop up there?
Why don't I do this one?
Sure.
Why don't I hop up and then you can swing around the back?
Okay.
This is a tall table. All right.
Nice. All right.
Okay. I'm good.
Fantastic. There's different names for this one. Mm-hmm. This one, I've had patients call it, say, like the sleeper stretch. This one can be used for just something that's really tight, like a capsule that's tight or some muscles that are tight. Mm-hmm. Frozen shoulder. I mean, there's different reasons, but in the side position like this, side lying position, with his elbow straight up, and you'll notice his arm, I'd like to have it as close to 90 degrees straight out if we can.
Okay.
And at this point, you're just basically trying to get the palm of the hand as close to the table as you can get it. Now, for some patients, going not even halfway is difficult. Normal range is getting it anywhere from like palm down to about finger touch. So it's close. So he can start to feel that.
I'm a little tight in my posterior capsule. Maybe we can have our lovely video assistant come a little closer so you can see this.
That's a good idea.
Let's see.
The idea with this one, though, and you'll notice that he put his other hand on top of it, I'll oftentimes have patients do a little contract relax, which basically means when you get to this point where you feel that stretch and you hold it for a couple of seconds, then this hand is used as a resistance to help this one push up with some resistance against it. So hand there, he's going to push this hand up gently into it for about 3 to 5 seconds, and then if he can, he'll go a little bit deeper using this to help stretch that just a little bit further, because oftentimes when you get to that point, it's hard to get even further down, so that this one is able to help that get there.
A lot of people call this that posterior capsule stretch, like you were saying, really getting the back side of your shoulder. Sometimes it's hard for me because I have really big shoulders.
That's true.
Yes.
I didn't want to say that, but that is very true.
It's kind of implied.
Yes. We got that exercise. Anything else with that exercise? Because we got one more.
I think that's great.
Okay. Then if you want, you can stay right there, Mike, because you're basically in position.
You bet.
Okay. So what I'll have for this one's different names again. You might see this one called the shoulder clock. But the idea with this one is you're basically just trying to get different motions with that shoulder while they stay in a sideline position. And you'll notice as he gets to this point, he kind of turns his hand open, because if he doesn't do that, it makes it more difficult. But if you want to add some rotation with his body, that makes it more possible for his shoulder to get all the way around. But the goal is getting him in that full clock as he does it. Now, you get some patients that might get to a point where, like right here, it's just getting tighter and tighter, so they come up a little bit, and they modify it as they extend back there. For now, if they're really tight and really sore, then that's maybe a good modification for them to use rather than try to force it and go all the way. He went the other way that time, so he's going counterclockwise. I like the idea. He's modifying this one, but some patients, for different reasons, find it easier to go one direction as opposed to the other. The idea is being able to go both directions as smooth as they can. You'll notice that he did it very smoothly. He's not going rigid or fast and then to a point where it's sore, because that's the other idea with this one. If it's sore, careful with it, because it's not meant to be really, really aggressive, but definitely you're going for a bigger range than maybe you would with other easier exercises.
You know, I find that shoulder mobility and shoulder motion is huge, isn't it? Right?
I agree.
And so not only if someone has especially like rotator cuff tears, rotator cuff tendonitis, a lot of these are used for frozen shoulder. But again, I think letting pain be your guide, having a little discomfort is good for that stretch. If you're in a lot of pain, okay, we need to back it off, right?
Modify it if you need to.
So these are kind of the more advanced shoulder stretches that we love, that are fantastic, and hopefully it keeps you limber and strong, and you have many happy days with your shoulder ahead. Have a great day.
Have a good day.